Dear colleagues, dear chairmen, I would like to present the finding of our research, which focused on very specific part of the immune system, known as the complement system, precisely on its role, on its diagnostic and prognostic role in patients with coronary artery disease. Coronary artery disease known to be silent for decades. However, in symptomatic patients, coronary artery disease can significantly decrease quality of life and limited everyday activity. At present time, we use very sophisticated visualization methods to diagnose functionally relevant coronary artery disease, and these methods associated with radiation and contrast risk, as well as they are not very available and expensive. And from clinical point of view, it can be used inappropriately in patients with very low pretest probability of coronary heart disease. In this situation, a good alternative to visualization technique can be using of biomarker. They are quite simple to be used. They are widely available, inexpensive, and not related to adverse effect. The complement system, the complement immune system, is known to be related to atherosclerosis, and today I would like to draw your attention to the lectin pathway of the complement system. 2 words about the biology of lectin pathway. It's not adaptive immune system. It doesn't change during individual's lifetimes. It cannot be influenced by antibodies and CRP. And lectin pathway is a cascade protein system. The main function of the complement system is to recognize damaged cells and to initiate protein cascade, and on final stage, they create a membrane attack complex that is able to diminish damaged cells or change cells. Let me say 2 words about main players. Ficolin, Ficolin and Imbel are both pattern recognition molecules. Their function is to find damaged cells and to initiate the complement cascade. And MAP19 is a regulator molecule that can influence the intensivity of and can control function of H-Ficolin and Imbel. We performed a single-center prospective cohort study, and all patients underwent rest and stress test, a single isotope emission tomography, and also we used data of coronarography, of angiocoronarography, and fraction flow reserve to detect coronary artery disease. We performed 1, 2, and 5 and 8 years follow-up. And in this study, we focused on the 5 years follow-up. Initially, we had 1,618 consecutive patients with suspected coronary artery disease. After excluding patients with low eGFR and those without available follow-up data, finally we had in analysis 1,571 patients. We measured our molecules before the stress test, immediately after, and 2 hours after the stress test. Let me proceed to results. H-Ficolin. It demonstrates significant increase immediately after the stress test, following decrease to baseline level after 2 hours. However, we did not confirm any diagnostic ability for this molecule. MBL, as well as H-Ficolin, also increased immediately after the stress test with following decrease, and also no diagnostic ability was confirmed to MBL. MIP-19, as well as two previous players, decreased after the stress test significantly, then decreased in 2 hours, and also did not confirm its ability to distinguish patients with and without functionally relevant coronary artery disease. Going to prognostic value, I would like to say that we tested different cutoff because it was the first study in field of complement in stable patients with coronary artery disease. But in case of H-ficalin, we found out that only patients with very high concentration of H-ficalin had high rate of myocardial infarction. However, in Cox modeling, H-ficalin did not confirm its prognostic ability. MBL also demonstrated in Kaplan-Meier analysis the ability to predict myocardial infarction, but after adjustment to other factors, it completely lost its diagnostic ability. And MIP-19, among studied molecules, it has the most potential and is able to predict myocardial infarction risk even after adjustment to other factors. However, its predictive value was not very prominent. So our study had limitation. It was single-center study, and it might not reflect the diverse patient population. We did not evaluate the relationship between our markers, the complement system markers, and other inflammatory markers such as interleukin, tumor necrosis factors, and CRP. And we did not account for the impact of statins, ACE inhibitors, aspirin, drugs that potentially can change outcomes in patients with coronary artery disease. In summary, I would like to say that none of study molecules confirmed the ability to distinguish patients with functionally relevant coronary artery disease and without it. However, MIP-19 shows potential as prognostic marker for myocardial infarction. Thank you for your attention. I would be happy to answer your questions.
Yeah, thank you very much. I appreciate very much that you show a negative study. So mostly we only see the big difference, but this is very important also to show negative studies. In your introduction, you said that there's maybe a challenge to overuse CT angiography, but what do you think about overusing biomarkers? Is that not also a challenge? So it's so easy to measure, just one blood draw, sent to the lab.
From the point of view of costs and radiation, biomarkers is not so difficult to use in clinical practice. And of course, it's like a good idea to find biomarkers that can show functional changes in heart, but I think that we have different cohort of patients and may study visualization technique and biomarkers in patients depends on the risk of probability of coronary artery disease.
Mm-hmm. Any questions?
I think then we go to the next speaker. Thank you so much.